Vaginitis is a medical term that is used to refer to any infection or inflammation of the vagina. The symptoms of vaginitis are common and most women will have at least one form of vaginitis in their lifetime. Even though vaginitis is so common, many women know little about it. The term yeast infection is what most women think of when they hear the word vaginitis. However, a yeast infection is only one kind of vaginal infection. Vaginitis can be caused by several different organisms, sometimes at the same time, as well as by hormonal changes, allergies, or irritations. Symptoms of vaginitis. The symptoms of vaginitis are feeling of heat and fullness in the vagina, a dragging feeling in the groin, increased urinary frequency and vaginal discharge, that is, leukorrhea. The clear or white secretion becomes purulent and yellow. The severity of leukorrhea depends upon the degree of bacterial infection. Abnormal vaginal discharge is the most common symptom. In bacterial vaginitis, mild irritation or burning of the vulva and vagina often without itching or redness, thin watery discharge often with an unpleasant odor, grayish-white or yellow in color and heavier than usual. In yeast infection, odorless, thick, white discharge, burning and itching sensation. Itching and or irritation of the genital region, redness in the perineal area between vagina and anal sphincter, redness of the labia majora and labia minora. Sometimes, redness in these areas can be hidden by pubic hair. Bacterial vaginosis. You may develop a grayish-white, foul-smelling discharge. The odor, often described as fish-like, may be more obvious after sexual intercourse. Yeast infections. The main symptom is itching, but you may have a white, thick discharge that resembles cottage cheese. Trichomoniasis. This infection can cause a greenish yellow, sometimes frothy discharge. Symptoms of a yeast infection associated with vaginitis may include whitish-gray discharge that may be very thick, or thin and watery, itching, burning and irritation of the vaginal area, itching, burning and irritation of the vulva, area of skin around the vagina. The symptoms of vaginitis vary with the cause, although most are characterized by a discharge, odor, irritation and or itching. Yeast infections involve genital itching and a thick, white vaginal discharge, while bacterial vaginosis involves a thin, gray vaginal discharge and a fishy odor. A Trichomonas vaginalis infection, on the other hand, leads to genital itching, a vaginal odor and a heavy vaginal discharge, which may be yellow-gray or green in color. However, symptoms may not always be present, or not always noticed. For example, nearly half of the women with clinical signs of bacterial vaginosis report no symptoms. Any woman can get vaginitis or inflammation of the vagina. The normal environment of the vagina is acidic, which helps to prevent overgrowth of organisms that can cause vaginitis. When disruption of the lining occurs due to extreme stress or antibiotic use, women may develop vaginitis. There are different types of vaginitis. The most common are yeast vaginitis, a bacterial infection called bacterial vaginosis, and vaginitis related to sexually transmitted diseases such as Trichomonas. Please subscribe to our channel and give this video thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.